Dacia, thank you so much for being here today. So I am so excited to have Dacia here. Dacia and I were coworkers at the YWCA together years ago. And Dacia now works at All Nations Health Center. And we have had so many questions about how we can work with, especially our Indigenous families at the Family Housing Center. Deisha also is on the board of the YWCA, so is very familiar with the Family Housing Center and the work that we're all doing. And so I'm really excited that she's here today to talk to us and just to give us all this wisdom that she has. So Deisha, I know we have you until 7. So I know you have a presentation and then some, I think you have some time for questions from us. And so I'm just going to turn it straight over to you.
Okay, thank you. Thank you for having me. I'm really happy to be here and happy to share what I can and try to be a connection and resource for you all in the work that you do. So I really wanted to focus. This is usually like an hour long presentation. So I've kind of condensed it as much as I can. So it's a lot of information. But I will share these slides so that you'll have them available, and then I'll share my contact information as well so you can always connect with me if you have additional questions. But really just wanted to talk about how we can bridge communities and support Indigenous families with All Nations Health Center. Just a really brief overview of All Nations. So we've been around since 1970. It was originally called Kwekwe, which I can't remember what that means. I think it means bison in Salish. We're a nonprofit organization. We're an urban Indian health center. We're one of 41 in the United States that has that distinction. So we're not Indian Health Service, but we operate like Indian Health Service under federal grants mostly, but also provide a lot of services. Our mission is to provide sustainable, healthy lives for our Native people and the surrounding community through culturally based holistic care. So we provide a lot of services. So that looks like medical, dental, behavioral health, and prevention and health promotions. So right now we're operating out of 3 locations. So we have a medical clinic at 830 West Central. It's really close to the Missoula Senior Center and in the neighborhood of Washington Middle School and Sentinel High School. And that's where our medical clinic is. So we have primary care, pediatric care, clinics, immunizations, all of that. In the same neighborhood, we have a dental clinic that does pretty general dentistry for all ages as well. And then at our Russell Street location, that's where I'm located, we do behavioral health services. So we're integrated behavioral health. So that means that we um, try to include behavioral health in all of our services as like a kind of wraparound support. But we do chemical dependency and mental health, traditional healing practices. So that looks like including cultural care into all of our services, but it's also some specific services like sweat lodge and access to smudge. And I'll talk about that a little bit more. And then prevention and health promotion. So this is where a lot of our community facing and community events come into play. And we also do programming specifically for youth and elders. So today I'm going to be talking specifically about um, Indigenous families and understanding the needs of Indigenous families. So we'll go over defining family, parenting and family roles, some cultural norms and practices that you might be seeing, challenges to family systems, and then how you can create supportive spaces. So first, defining family. So for Indigenous families, we're considered a collective culture. So that just basically means that when we look at who we are and defining who we are, I don't define myself or view myself as one person. When I'm thinking about who I am as a person, I think about all the people that I'm connected to and related to. So that's my children, it's my nieces and nephews, my cousins, my aunties, my elders, it's the ancestors that came before me, and it's also the family members who will come after me, so the future generations. So that's like my worldview, and that's the worldview of Indigenous people. We're Western society is more centered on self. So when you think about who you are, you think about your own self and your own personal experiences. Um, this isn't like a isn't something to say like this is better or this is better. It's just the perspective. So it's just different ways of viewing the world, and that's a really important place to start, because then that impacts decisions that I make or um, how I experience programs or services. And then cultural values are things like respect and reciprocity, interdependence, so depending on one another, and that's something that's been a cultural value that was based on survival and still is in a lot of ways. So, looking at the parenting and family roles and what that looks like now, so roles can really change based on circumstances and needs. Family support can look like mom and dad, it can look like just mom, it can look like just auntie or grandparents. So, every family is going to be different, but most of the time it's not a nuclear family. I would say like, yeah, definitely most of the time it's usually not just like mom, dad, kid, dog. Like doesn't typically happen like that for Indigenous families. So we have a lot of multi-generational families that live together. And I think in terms of family promise and family housing, that's a huge consideration that is important to understand because when families come into shelter, it might be that uncle is with them too, and that family might qualify for services. And then the service provider could say, well, uncle can go to the Poverello Center or somewhere else. That family wouldn't want to separate from uncle because he's just as much part of the family as mom, dad, or one of the kids. Elders also play a central role in raising kids. So for some tribes, it's really still common practice for a grandparent to raise a firstborn child. So just depending on the tribe and their practices, that's pretty common for some tribes, and we see that a lot still of grandparents raising grandchildren. And of course, that also happens just circumstantially depending on a family situation. And then another thing that we see a lot is the role of siblings, especially older siblings, having a lot of responsibility to help take care of the little ones, and that's a really common practice that's been around for forever and ever. And I think it's just part of coming from that collective society where everybody has a role, and it's important for older siblings to start taking on that caretaker role. So that can be tricky in like a shelter situation where there could be rules about kids being left alone, where for the family, it could be really normal for the older kid to take care of the little ones, and that could be their common practice at home. So, some other cultural norms and practices that you might be seeing. So, one is smudging. So, just I'm not sure how familiar people are with this, so I just put together a little definition. So, smudging is a sacred practice used for purification, prayer, meditation, or connection to Creator. And depending on the tribe or the person, it varies how it's done, but the most common medicines that are used are plants are sage, sweetgrass, cedar, and tobacco. And they're used by burning, and then it has like a smoke, like a fragrant smoke that comes out, and then that's used for prayer, for cleansing energy, for promoting healing. And yeah, like I said, it depends on the person or tribe. Not everybody smudges. Some people only use certain plants, some people use all of them. So it just varies from tribe to tribe and person to person. Another big one is concept of time. So historically, Indigenous people view time as part of like larger cycles. So it has to do with like seasons and life changes and ceremony, community events. And there's like the priority is on relationship and connection and not on like schedules and times of day. So we joke about Indian time, so you might have heard that's kind of a humorous way to look at time, but it's really like, oh, I'm late, I'm running on Indian time. It really sounds like we're joking, but it kind of has a deeper meaning behind it that reflects that the value is placed on relationships, patience, adaptability. It's not laziness or disrespect. It's not meant to come off that way, but it can look like, oh, this person's always late, or they didn't make it to their appointment. And it could be a series of events leading up to that, that maybe they didn't want to interrupt something, or they ran into somebody that they needed to connect with that just kind of leads up to that. So also, events can, like a scheduled appointment that's supposed to be like a 30-minute check-in, might be like 45 minutes or an hour if that person is connecting with you. Um, so one thing too is like interrupting is really difficult. A lot of times it's not the norm to interrupt someone, so you just let them talk until they're done talking. And so then that can lead to like, oh no, I'm like 45 minutes late because I didn't want to interrupt. So yeah, that's probably something that you're seeing a lot. Okay, some challenges to Indigenous family systems now. So, of course, historical trauma has had a huge impact on traditional family systems and what they look like now. So, some families are intact and have all of those connections that are meaningful, have that support system. A lot of families have had forced separation from each other, forced separation from their tribal community and their culture, and that impacts people in a lot of different ways. Socioeconomic factors, so just lack of access to resources, education, healthcare, that impacts communities and family systems. Cultural displacement, so this is ties in with both of those, but um, especially in Missoula and other places where people have to leave their communities, or generations back had to leave their communities, and they're not connected with their culture, or they're like reconnecting with their culture. Sometimes that makes those bonds even stronger, that it's even more important that they're going to fight even harder for uncle to stay with them. And sometimes they just don't have that same sense of connection or support system. So it can look different in different ways. And then a misinterpretation of cultural norms. So on the last slide, talking about Indian time, where one person can see that as like, this person's always late, or they're not making it to their appointments. They don't care about getting housed, or they don't care about this appointment. It's not important to them. So just that, depending on like being aware of what perspective you're viewing the situation versus how they might be experiencing the situation. So that happens a lot, especially with like schools and different systems that are set up with time frames and schedules, and be here on this time or you're late or we have to reschedule. So it can lead to bias and stigmatization. So things that you can do to create supportive spaces. So listening and learning, actively listening to Indigenous clients and learning about their specific family structure and needs. So who is in their family, and whoever they identify, just acknowledge and respect that that's who their family is. Even if it's not like a blood relative or like a third cousin twice removed or whatever that is. We don't, like, those concepts aren't normal for us. So it's, if you're my cousin, you're my cousin, no matter how far apart we might be. Um, so just listening and learning and just accepting their definition. Building trust. So this is something that can take a while, might not ever happen completely for certain families, but just taking time to build relationships with people. That's really, really important. Um, Knowing that you care, also being really intentional with your words. A lot of times we are kind of slower to respond because we're taking time to interpret what was said, if that makes sense. Um, and yeah, I think sometimes people can feel overwhelmed going into these systems, or services that people are judging them. So I think just being patient and not bombarding with information and offers to help. And yeah, I think just taking your time to build that relationship is important. And then making an effort to be informed on issues and current events affecting Indigenous communities, and also seeking those resources out yourself without relying on Indigenous people for that labor, especially clients who are in crisis already. So making sure that you're not expecting them to educate you on their specific tribe or culture, unless that's something that they bring up and want to share with you. Um, Making sure you're not getting all of your information from them, but seeking out resources on your own. Okay, some practical strategies that you can use, making sure you're using inclusive language. This can also be in like forms that you might be filling out. And I think this is good practice, like for all kinds of populations. Empowerment through cultural practices. So making sure that when it's appropriate, you can promote cultural practices in whatever programming is happening. Being flexible, so accommodating to cultural practices. So for an example, if someone is consistently late for an appointment, acknowledging that that's happening, and then maybe scheduling like a block of time that's bigger, or a time frame that's more flexible. Um, Involving Indigenous voices, especially when you're making programs, materials, or decisions that are going to impact Indigenous people, and then accept feedback. So if you involve Indigenous voices and they give you feedback, then use that feedback, so that people are willing to continue collaborating and working together. And then this is my contact information. So I'm at the Behavioral Health Clinic on Russell Street. We're next to Kid Crossing and across the street from where Spirit Halloween store sets up. Our website is allnations.health, and my email address is on here as well, dgriego@allnations.health. And you're all welcome to reach out to me anytime if you have questions. But I would like to open it up to anybody who has questions or wants to clarify anything.
Well, I probably have a question. I think, thank you for your information. I think thinking about family that way differently than what we think sometimes is helpful to understand all that. But one of the things that I seem to notice, and I don't know how, I haven't looked at the statistics lately, but it seems like we have a higher proportion of families that are native or indigenous and is is there anything that it seems like we're there's is there something else that we need to be doing, I guess, in the community so that it seems like there's a lot more. I don't know. Am I making myself clear? I mean, what could we
Like
do?
you're
What
seeing a
could we
lot more,
do? Yeah, it just seems like
a lot more families,
there's
yeah.
more impact from there. I mean, they seem to be impacted more.
Yeah, so I don't know the statistics off the top of my head, but Native people are definitely more impacted by houselessness and domestic violence, at disproportionate rate. So we definitely have a um, higher rate of experiencing houselessness and housing crisis. I don't know the answer. I wish I did. I think that one thing that All Nations has talked about is trying to create housing, as at some point. That's not on the docket yet, but that's definitely like a conversation that's being had at All Nations, is like, what can we do to help address that? But yeah, I don't know the answer or like the exact cause. I think housing in general is really difficult, and I think in most situations, like Native people are just affected and impacted a lot more.
And Dacia, is that housing would be in Missoula specifically, or looking more at the reservations?
So
Um,
All Nations, any programming that All Nations does would have to be within Missoula County,
Gotcha.
because we can't overlap with tribal entities that have their own IHS, basically. So kind of like jurisdiction or territory or
Sure. Yeah, that
coverage.
makes sense. I was
I
just
do
curious.
also
I don't know if you followed the common goods well, Jenny Mish and Jody Cahoon Perez starting the Solidarity program, which I
Yeah.
think is focusing on housing on the CKST.
Yeah.
So just an kind of interesting and exciting initiative, but that's, not in
Yeah.
Missoula.
Yeah. And then I think one thing that happens too is that members of different tribes like do end up coming to places like Missoula or Billings or some of our more urban locations that have more resources and have more jobs, um, hoping to be able to like provide for their families. And then it's hard. It's hard to find housing, affordable housing.
Yeah, that makes sense.
I did want to mention with All Nations, our medical, dental, and behavioral health programs are open to all, so including non-native. So you don't have to be Indigenous or a tribal member to receive services through those programs. Some of our prevention and health promotions programs, you do have to be an enrolled tribal member, but we're really pretty good about like advertising which programs are open and which ones are closed.
I just want to thank you for all the information. I think it's very helpful for everybody. I've personally lived on several reservations as an adult and a nurse, and yeah, there's a lot of cultural things that we really need to be respectful of.
Yeah, and I think one thing too is like trying to have the perspective of viewing these differences and cultural values as strengths, and how can you really look at like somebody's view of their family system or their view on time or whatever it is as a strength for them and a resilience factor, and kind of use that to empower them rather than having the perspective of like this is an obstacle for us. Just kind of switching that mindset a little bit, I think can make a really big difference.
Yeah, I love that. I think it's really beautiful that there's the inclusive understanding of what family is, and even with time that we're like focused more on relationships than that's kind of how we navigate. I think we have a lot to learn.
Yeah, especially with like events, you'll see like a lot of time we're getting pretty good at starting on time for our events, but a lot of times it's like you start when everyone's ready, and that might
Right.
be like exactly at 7 o'clock, but it might be like 7:15 or 7:30, and then you end when everybody's done. And that might be like when we have powwows in the community, people will ask like, what time is it done? And it's like when it's finished, it's done. I'm like, I can give you kind of a general idea, but that's really like at nighttime sometime when it's finished. So
I have a question also about time. Once in a while, there's a meeting or a time frame, a deadline that if it's not met, there are kind of bad consequences and opportunity is missed. How can you address that without shaming, blaming? When I think about it myself, it's like when I have said to my kids, okay, there are consequences, but that does not sound like the right thing to say to adult people who are in crisis and need some help.
yeah, that's tricky. I think the word consequences is like triggering for everybody because of being kids and hearing like these are your consequences. I would say like just reiterating like it's really important that this happens by this day or at this time, and then problem solving ahead of time. Like, do you need help with transportation to make it to this appointment? Is it helpful if I call you an hour before you need to be there? Is it helpful if I give you an email the day before? So just trying to be proactive, I think, about reminders. Does the person have a calendar or like a planner that they can write the event in, or is it a phone reminder? So just trying to be like proactive in the situation, and then but also reiterating like it's important that this happens by this time. If not, you could risk losing this
Yeah.
opportunity or whatever it is.
That's helpful. Thank you.
Mhm. You do have any families that you're working with that want to get connected with All Nations, you can refer them to me as well. Or they can go to either the medical clinic or the behavioral health clinic. Typically Monday through Thursday, 8 to 5, somebody is there. Fridays we do half days until noon, and so they can come during that time too. But walk-ins or appointments are both welcome, and or they can call or email if they want to get set up. And it's a pretty simple process to get registered and get an intake and set up with services.
Thank you so much, Dacia.
Yeah,
You're
thank you.
welcome.
That was
I
Yeah,
loved
thanks
wonderful.
for
seeing
having
you.
me. Thank
Thank
you
you,
so much
Dacia.
again for having me. And
Yeah, thank
um,
you.
yeah, let me know if anybody has questions down the road. Feel free to reach out.
That would be awesome. Thank you.